Hi everyone, my name is Dr. Michael Wald and I'm a doctor of chiropractic, a board certified nutritionist, dietitian with a life coach certification, and I also provide acupuncture. I attended medical school, earned my MD diploma, but decided not to get an active license. So today's conversation is about hypertension or high blood pressure, entitled Say Goodbye to High Blood Pressure. It's possible to manage your blood pressure without medications, but we're going to talk about the medication approach and the nutritional approach. So to begin with, the information that we're about to discuss is for your educational purposes only. It is not meant as a substitute for sound medical, health, or nutrition advice. So let's start with what many of you actually already know, and that is that hypertension is otherwise known as the silent killer, simply because it may not produce any outward signs that a person is aware of until they experience their first stroke, for example. So it's important to at least know some of the basic symptoms of hypertension in both men and women. And they actually can produce different symptoms in men and women. So for example, headaches, persistent or severe headaches, especially headaches in the morning, might indicate hypertension. Dizziness or lightheadedness, feeling unsteady or faint due to high blood pressure fluctuations is very common. Then there's blurred vision. Increased pressure can damage the eyes, leading to visual problems. Who would have thought? Chest pain may indicate strain on the heart or risk of heart disease. Shortness of breath, difficulty breathing, especially during exertion. Nosebleeds. Occasional nosebleeds, although not always, may be linked to high blood pressure. I was once having dinner with a client, and during dinner, his nose started to bleed profusely. It turned out that he had a blood vessel popped in his nose. Thank goodness it didn't pop in his brain. And then fatigue and weakness. Reduced blood flow can cause low energy levels. So familiarize yourself with these symptoms. Additional symptoms in men could be erectile dysfunction because of poor circulation and blood flow to the penis, and lower libido. High blood pressure may reduce testosterone levels and desire for sexual intercourse. Additional symptoms in women include flushing or facial redness, more common in women due to blood vessel changes, and also anxiety and sleep disturbances. High blood pressure can be related to hormonal fluctuations, which can exacerbate hypertension effects. So it's also essential that you know something that most doctors will not teach you, because hypertension is among the most prevalent causes of death in most men and women, and sometimes blood pressure measurements are taken wrong even by, or I should probably say, especially by health professionals. So one mistake in taking blood pressure is using the wrong cuff size. A cuff that's too small will overestimate blood pressure readings, while a cuff that's too large tends to underestimate blood pressure in the individual. Improper arm positioning. You want the arm at the level of the heart. You don't want it too high. You don't want it too low. You do not want to talk during the measurements because that can falsely increase the measurements. You want to make sure that if your health professional or you are taking your blood pressure, you do not want to take it over your clothes, because a sleeve under the cuff creates inaccurate pressure distribution. Also, and this is very common by health professionals, it's not allowing proper rest time. So measuring immediately after activity or stress will produce higher blood pressure readings. I was actually testing my primary doctor, her skills out, and I ran up the stairs to her office, which was just on the second floor, and within 5 minutes they were taking my blood pressure and were all excited about how high it was. They're supposed to have you relax for at least 5 minutes, preferably 10 minutes. And if it's high after that, they should take it again after an additional rest. And you do not want to have your legs crossed, because that can raise blood pressure by increasing vascular resistance in the body. So how do you take your blood pressure correctly? So first, to ensure an accurate blood pressure reading, have the person sit calmly, as I mentioned, for a minimum of 5 minutes. You want their back supported, feet flat on the floor, and arm at heart level, not too high, not too low. you want to use a properly sized cuff placed on the bare skin of the upper arm. And you might notice that blood pressure cuffs have an arrow. And you want that arrow to be pointing to the biceps crease. So with the arm, the bicep crease is right here. There's the bicep, and here's the crease. The arrow should be pointing right there. If it's too high or too low, you're going to get false blood pressure readings. And you want to inflate the cuff slowly. If you're using the manual method, you have that little plastic ball, or rubber ball, you squeeze it slowly as you're listening with a stethoscope. But if you do it too fast and too high, these can cause problems. You go nice and slow until the sound that you were hearing, the thump, 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 goes away. Then you slowly release the air pressure using the valve, turning the valve on the blood pressure device. And then you'll start to hear dump, 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 dump. And then when you don't hear it again, that's your diastolic pressure. You can watch YouTube videos on this as well. So what is hypertension and its types? So hypertension, or high blood pressure, occurs when the force of blood against artery walls is simply too high. But it can have many, many different causes causing that high blood pressure to be high. And many doctors fail to go deep into why or what are those reasons that cause that high blood pressure. So there are the primary type of hypertension, the secondary type, and then I'll discuss risk factors. So primary hypertension is there's no clear cause that's linked to the causing of the hypertension. So it's usually said to be from lifestyle or possibly genetics. And then there's secondary hypertension, and as the term suggests, the hypertension is secondary to other diseases, maybe hormonal disorders or kidney disease. And risk factors for hypertension, the basic ones include age, obesity, stress, diet, toxins, and inactivity. So the systolic pressure is the top number, and the diastolic number is the bottom number. So the systolic pressure should be less than 120 or less, and the diastolic should be less than or equal to 80 millimeters per mercury. So a reading of 120 over 80 millimeters per mercury or lower is considered normal and healthy. However, if a person has a weak heart, they might get a low readings, both systolic and diastolic, and sometimes the doctors say, that's fine. But they're forgetting to read the blood pressure readings in context with how old the patient is and other factors, because medicine is rushed. And by the way, when I was testing my doctor's skills in terms of blood pressure readings, within 15 minutes of the appointment, she had written me a prescription for lisinopril, one of the antihypertensive medications. Oh my goodness. So there's stage 1 hypertension and stage 2 hypertension. So stage 1, by definition, has a systolic, the top number, between 130 to 139. And the diastolic, the bottom number, between 80 and 89 millimeters of mercury. And stage 2 hypertension obviously has gone further along. The systolic is equal or greater than 140 millimeters of mercury for systolic, and for diastolic, it's greater than or equal to 90 millimeters of mercury. Now, here's something you probably have not heard about, and your physicians will have forgotten about because they'll never mention it, but it can be very, very important and even diagnostic. Could make a huge difference in the choice of the medication, let alone the nutrition. So it's called pulse pressure. Let me define that for you very simply. The pulse pressure is the difference between the systolic pressure and the diastolic pressure. You take the top and you minus the bottom. That's it. So pulse pressure is systolic blood pressure minus the diastolic blood pressure. And that reflects the force that the heart generates with each of its contractions. Normal blood pressure or normal pulse pressure is typically between 30 and 50 millimeters of mercury, with a narrow pulse pressure less than 30 millimeters of mercury, indicating low stroke volume. And that could be from heart failure or blood loss, just to name a few of the common causes of that. But a widened pulse pressure is greater than 50 millimeters of mercury, and that might suggest arterial stiffness and something called aortic regurgitation. These are completely different conditions that give us a normal pulse pressure, or high blood pressure, I should say, and a lower pulse pressure. And if you know something about the conditions, then you might choose a different medication and certainly would choose different nutrition. So what are some gender differences in blood pressure? So men are more likely to develop hypertension before age 65 due to higher sympathetic nervous system activity and lifestyle factors like alcohol intake. And women, after menopause, estrogen declines, and that can lead to higher blood pressure risk, particularly after age 65. So here are some of the lifestyle factors that could contribute, cause, or worsen hypertension. One is high sodium and processed food intake. Too much sodium causes too much fluid retention. Too much fluid retention creates increased pressure in the blood. Also, obesity and sedentary lifestyle increases the heart workload. And then chronic stress and poor sleep can also elevate blood pressure. And there are various medical conditions, kidney disease, hormonal imbalances, such as high cortisol, that stress hormone, and aldosterone, which both increase blood pressure. Diabetes and high cholesterol damage arteries, causing stiffness of arteries, causing blood pressure to increase. So again, just reflect back to your visits with your primary doctor or your family doctor. They're the two practitioners that tend to manage your blood pressure. Have they asked you about all of these details? Probably not. They're just very, very quick, I'm sad to say, to writing that prescription. It's a waste of intelligence as far as I'm concerned. So what are some of the environmental factors that can contribute or cause hypertension? Heavy metal toxicity, exposure to lead, cadmium, mercury can damage blood vessels. These metals can impair kidney function and increase blood pressure. Practitioners in traditional medicine never ask, I would say never ask, about heavy metals. Also, air pollution and chemical exposure. Long-term inhalation of particulate matter, industrial chemicals, and toxins trigger oxidative stress, vascular inflammation, and can raise hypertension risk. And then there are other environmental factors, endocrine disruptors, as they're called, plastics. By the way, if you want to know much more about plastics, if you go to my website at drmichaelwald.com and search the search bar or go to the podcast section, there is a plastics presentation that is very complete. So plastics can disrupt hormones, and then there are various chemicals in plastics and pesticides and processed foods. All of these can interfere with hormone regulation, can increase cortisol levels and aldosterone, which are two hormones which raise blood pressure and contribute to hypertension. Even noise and chronic stress can lead to hypertension. Persistent exposure to traffic noise, workplace stress, urban environments leads to increased sympathetic nervous system activity, and over a period of time that will cause elevation of blood pressure in most people. I had an individual, a patient, who is now on 3 different blood pressure medications. We're now exploring the causes of them, but his doctor thought that those were just fine to just, when the first one didn't work or didn't work completely, to put him on another one and put him on another one. Failure to looking for causes. And let's remember, these medications are not without their own dangers. First, there is what's known as the first therapy. Practitioners are supposed to look at lifestyle and diet first in a comprehensive way before prescribing, or in the case of that gentleman, in my opinion, over-prescribing hypertensive medications. So some of the medications are here. I've listed them for you, like diuretics, HCTZ, furosemide. These are antihypertensive medications that deal with the fluid retention issue that can cause hypertension. And then there are the class of drugs called ACE inhibitors like lisinopril, and they relax blood vessels, so they work a little differently. Then there are beta blockers like atenolol, which lower heart rate and thus lower blood pressure, and calcium channel blockers like amlodipine, which improve blood flow. So what about nutritional ways of managing blood pressure? Well, there is what's known as the DASH diet, DASH, for dietary approaches to stopping hypertension. And it's a good basic place to start. I find that it's almost never enough, though. I see people that have tried this for years and it's not working. But it does have some suggestions which are important to consider. For example, increasing fruits, vegetables, whole grains, and lean proteins and nuts in your diet makes sense. Limiting salt to less than 1,500 milligrams per day. Eliminating processed and sugary drinks, all of those things could potentially cause hypertension. And then making sure you're well hydrated. You want to aim for 2 to 3 liters of water per day to support circulation. And again, if you search any podcast platform, ask the blood detective for how much water do I need every day, it'll give you several ways of figuring out the proper water balance, because it really is that important. Some cases of hypertension are caused solely by underhydration. So let's talk about some nutritional supplements. I've named a bunch of them here, but you'll see, and I'll talk about this in a few moments in more detail, that a person needs what they need for their needs. So these are just some nutrients that may be common. Some people might get their antihypertensive effects with 4 or 5 of these. Others need several different ones of the nutrients on this particular list. But I thought I would give you a comprehensive review. So magnesium is known to relax blood vessels and reduce the stress response. So magnesium is used in medicine to lower hypertension in the form of intravenous magnesium in hospitals, particularly for pregnant women who they do not want to use these other medications due to effects on the fetus. So they use high doses of magnesium. It works great. Now, the dose of any of these nutrients that you might need will vary. It could vary greater than or less than the doses that I've suggested here. But these are the dose ranges for each of these supplements that are the most that I've seen in my 33 years of in the holistic field. And then there's potassium, very important for lowering blood pressure, which helps balance sodium. Then coenzyme Q10, which improves heart function and also lowers oxidative stress and inflammation. So depending on the causes and mechanisms of what your hypertension, what underlies your hypertension, the informed and educated practitioner is able to detect that and to pick out the right nutrients which work on what you actually need. And there's omega-3 fatty acids, very, very important for most people. Reduces inflammation, improves vascular health, reduces blood thickness, what's known as viscosity. If your blood is too thick, then your heart has to work too hard to move the blood around, pressure goes up. Also, omega-3 fatty acids soften arterial walls and allows them to stretch so that the pressure, if it's contained in here, the pressure can be very hard. But if the blood vessels can expand and contract, then the blood pressure can be regulated. Then there's garlic, which helps thin the blood. There's arginine, which is what's called a nitric oxide inducer, which means it helps the blood vessels produce nitric oxide, which is a vasodilator. That's good. More space in the blood vessel reduces the pressure. Vitamin D3 supports cardiovascular health, reduces arterial stiffness. Hibiscus extract, which acts very, very much like a ACE inhibitor drug, lowering blood pressure. I won't go over all of these because they're written here for you, but I'm going to name just 2 more. Resveratrol, which has many health benefits, including helping to protect arteries, reducing arterial stiffness. And then N-acetylcysteine, which reduces vascular inflammation, lowering blood pressure. And also NAC, or N-acetylcysteine, is a heavy metal chelator, which means it binds to heavy metals. And heavy metals can raise blood pressure, but your doctors are never considering heavy metals. That's a mistake. So in terms of testing, minimum testing, and of course, depending on your medical health history and your health goals, this list might change, but these are some fundamental lab tests to consider. One is a blood lipid or fat panel. So you want to look for high cholesterol and triglycerides, which increase blood pressure by plaque buildup. And then there is the comprehensive metabolic panel, abbreviated CMP, which evaluates kidney function and liver function. And we know that renal function or kidney function can cause fluid retention and bring up blood pressure. We want electrolyte panels. We also want to look at blood sugar and cortisol and aldosterone levels because of what I mentioned before, how both of those hormones raise blood pressure. And in addition, we want a CBC, which is a complete blood count. Sometimes people will have a high level of red blood cells, and that will be a strain on the heart, raising blood pressure. And also you can have iron anemia, and that means that your red blood cells are not supplying oxygen well to the heart and other tissues, so the heart increases its contraction and the stress on the heart, which can raise blood pressure if you're chronically anemic. Very common mostly in women, but does occur, of course, in men. And then C-reactive protein, CRP, measures inflammation linked to arterial stiffness and heart disease. But you want the CRP cardio test, not just the CRP test. The CRP cardio picks up inflammation and problems earlier than the CRP. So when your doctor says, oh, I do the CRP, what's the difference? There's no difference. They are lying to you, or they just don't know. That's a common one. And then homocysteine, that's a toxic amino acid. High levels of homocysteine do indicate vascular damage and increased arterial stiffness or atherosclerosis. And homocysteine is corrected with nutrition. It usually means a person needs more folic acid, B12, B6, vitamin C, E, and B1, roughly in that order. And then you want to check for thyroid health, because thyroid dysfunction does affect blood pressure, either one direction or another. If you have hyperthyroidism, that will cause hypertension. If you have hypothyroidism, that can lower your blood pressure dangerously. And then looking at your ferritin, which is a iron storage protein. High levels of it can suggest iron storage disease, which is a significant problem, damages the kidneys, causes hypertension, and many other problems in the body. It's a devastating disease called hemosiderosis. And but high levels of ferritin suggest inflammation, oxidative stress, or as I just mentioned, iron overload. All of those things can impact high blood pressure. And then vitamin D. Low levels are linked to blood vessel dysfunction, which can result in high blood pressure. So what I think is needed when I see a person with hypertension is, first, we want to look at their diet. So we have them take a 7 to 14 day food record of what they're eating and drinking and time of day, and I make a rough estimate about their dietary constituents and issues with the diet. Is there too much sodium? Is there too much saturated fat? Blood sugar issues, high refined processed foods, all the basic things. And then I'll always measure a body composition test, because any improvement of blood pressure that goes along with improving body composition is much more lasting. Plus, a body composition tells me someone's metabolic rate and also the percentage of muscle, water, and fat in a person's body, and that helps me dose nutrients. And then when you give nutrients, maybe let's use magnesium for example, the amount of magnesium we might use almost always is much higher than the recommended daily allowance. So I say on all of my podcasts that the RDAs, the recommended daily allowances, are the minimum amount of a given nutrient to prevent a deficiency disease. It is not the optimal amount, what is also known as the orthomolecular dose, the optimal amount. So for example, even vitamin C, the RDA is 60 milligrams, but most people need 2,000 to 3,000 milligrams for optimal health. So the same may be true of everything in that list that I gave you several slides back of potential nutrients that may help blood pressure depending on the cause. So depending on the cause or causes, you target the nutrition, you target the foods, you manage the lifestyle, the exercise, the sleep, the stress. You must look at all of these areas, environmental toxins, and other things that might come up in a person's health history. Well, that'll wrap it up for this presentation on hypertension. I thought and I hope you found it useful, and let me know your thoughts, and I'll see you at the next presentation. Thank you.